I'm the owner and instructor at Atlantic School of Reflexology, and today we're doing a live stream about how you would do reflexology for someone with particular health goals. So I have with me Michael. He's got some back problems. He's been talking about low back pain and tightness, as well as some pectoral tightness at the front of the chest. So we're going to start with that. And what I want to do here is, this is for everyone, whether you have reflexology experience or whether you are currently a reflexologist practicing professionally or just curious about it, maybe looking at it for a career, or maybe just looking at how you might do this for yourself or for someone in your family. So things that I'm going to show you, I'm going to assume that we've already done a full session. So in reflexology, what we would do is work the entire body and every part of the body, every part, every gland, every muscle, every organ. And at the end of working through the entire system, so that you know you've touched on every single reflex relating to every body part, then we go back and rework certain key reflexes that have to do with the condition. So that's where we're at now. I'm going to do just a treatment session as if we have finished globally working on the whole body, and I'm going back in for the treatment plan, okay, specific reflexes for a goal. What that means is if anybody else has similar problems with their body that I'm going to be working on, you can go to the same reflexes that I'm going to and work them that will send a signal to the body to release muscle tension, increase relaxation, increase circulation, bring more oxygen to the tissues, flush away more waste from the tissues, etc. We'll probably do some pain relief reflexes. We'll probably do some anti-inflammatory reflexes. So you can actually work right along with us with this video, or you can feel where these reflexes are on your own body and press into them as I'm walking us through this. So, I'm going to start now with Michael. I've already washed my hands. I washed his feet. He has nothing on his feet that shows me that it would be dangerous to work, so it's safe to proceed. And Michael, can I ask you a couple questions about your back?
Yes.
So can you describe the low back pain or tension or what the problem is?
It just tight from the mid back down into my upper hips. So when I attempt to get up or just get up for moving around, it's very hard to move around at first. So
Okay. Would it be easier for you to show me on the front of your body what level of your spine you mean when you say mid back?
this part here.
Okay, all right, cool. Mid back downward to the top of his hips. And then is one side worse than the other?
Left side seems to be a little bit tighter than the right.
Okay, and does it affect your hips or anything going down your legs?
My hip reflection is on the left side of the extremely tight as well. So
hip flexors on the left. Okay, all right. And how would you describe the pain? You said it was just a tightness. Is it ever
tightness and nighttime at the end of the day? It's just wear and tear, but there's a lot of throbbing and just almost a seized up of the muscles itself. So
okay. So what I could also do, and what you guys can do, anytime you're doing a reflexology session, you can ask your client to show you their current pain-free range of motion. So if I'm doing anything with low back, I could get my client to stand and then just kind of bend over into flexion as if they're touching their toes and just see how far they can comfortably go into that position with zero discomfort whatsoever. So they're not going into discomfort to prove to me where it starts hurting. They're staying at the edge of that, at the other side of it, so they're comfortable. And what we can then do is we can test afterwards if we had an effect by getting them to redo that and stay in only comfortable range of motion and see if they've increased or gained any range of motion. Now, because we're already all cleaned up, we're not going to do that today, but it's an idea that you can do for either yourself or for someone else that you're working on. So, so let's start this. I'm going to start by working on the actual spine. What I'm going to do is show everyone the bony landmarks of the spine, so you'll be able to find the spine reflex on your own foot very easily, but also be able to detail exactly where you can hone in on a very particular set of vertebrae or a particular nerve that might be affected or a particular disc that might have slipped. So in other cases, using the spine to work on any kind of spinal problems at all, or even just to work preventatively and keep proper energy flowing through the spine, I'm going to show you how you can find all the parts of the spine. So number one, if you look at a reflex map, then we'll see that the spine is located along the medial aspect or the inside part of the foot. It's on the big toe side, and in reflexology, we would call that zone 1. So we actually don't have the spine on the bottom of the foot. It's not plantar on the bottom. It's actually up on the side of the foot, on the inside of the foot. And because we can see this one better, I'm going to show you on this side. So for the spine, you're going to start mid-heel on the side of the heel. If you can see where the puffy pad of the heel is on the bottom of the foot, move up onto the side, and then from here, go halfway down right on the side of the heel, there's a tiny little indent that you can feel in here. For those of you who are familiar with reflexology, that's also one of the reproductive reflexes, but it's superimposed with where the tailbone would be at the base of the spine. Okay, tailbone is also called the coccyx. So we start here and we use our thumb to start pressure walking up the inside of the foot. And what I should do is just underneath the ankle bone here, along that same line that I'm following up the inside of the foot, I should start to feel some bony ridges in here. I'm going to feel the bony ridges, the bones of the arch. So I'll keep caterpillaring or keep pressure walking all the way up. I'm going to flip my fingers that are supporting my grip up as I continue on. And all the way up, I'm staying just tucked underneath a little bit to the bones of the arch and of the foot. When I get to the ball of the foot, I'm going to move my grip up and hold the ball of the foot. I'm going immediately central between top and bottom. And then when I get to the big toe, I'm going to hold the toe. Now what I just did here is I caterpillared up the spine reflex. Here's what you need to know about it. The base of the spine is at the heel. The head is the toes. And so if this top part of the toe is the head or the cranium, that first joint where the head is sitting on top of the skinny part of the toe, that skinny part of the toe is the neck reflex. So cranial reflex or cranium or head sitting on top of the neck reflex, which is divided by that first joint if you just bend the pad of the toe. So from the top of the neck down to the base of the neck reflex, the next joint that I bend is in the ball of the foot. So from the first joint at the tip to the next joint, that's all neck reflexes. That would be called cervical vertebrae as reflexes for the neck. It starts at C1 at the top and it divides down to 7 different vertebrae until we get to this next joint. At the end of the neck reflexes, now we hit mid-back, upper and mid-back, which would be the thoracic area. So C7 sits on the bottom part of this joint, which is actually the beginning of the long bones in the feet. It's the first metatarsal. And that is actually T1 or thoracic 1. And it goes all the way down to T12. So here's a trick on how you can find T12, which is the base of the thoracic spine. If you're just taking flat fingers and you just glide them at the inside of the foot, the first bone that really protrudes, that's a navicular bone. It's a navicular process. So it's really kind of a very telltale bump as you're moving up the inside of the arch on the side. And it's the first real protruding bump here. So that's the navicular process. So between the base of the joint in the ball of the foot and that navicular process, that's the entire T-spine or thoracic spine, starting at T1 at the top to T12 at the bottom. Okay, so now maybe these numbers don't mean anything to you, so just imagine that this is upper body, this is lower body, the lower bone of the toe is the neck, and immediately below that is upper back moving to mid-back. Our next division is going to be lumbar spine, which is a low back. So this is Michael's primary complaint, is he's saying the low back is tight, and he says it's particularly tight on the left. So if I go to this medial malleolus, which really is just the ankle bone, okay, so the inside ankle bone, and I pretend there's an imaginary dotted line that goes all the way down and crosses through the spine. So it's crossing this way. Where it passes through the spine, the upper part of that is going to be your lumbar spine from the navicular bone down to where that dotted line is. Okay, so if we're at the navicular bone, which is T12, the end of thoracic, and then we know that next to that is going to be the first lumbar or low spine vertebra, then we can just count down. There are 5 of those. So we're going to go down to L5, and we know where L5 is because there's an imaginary dotted line that bisects that spine line. Okay, down from the ankle. So that means that that's L5 just above that, and just below that is sacrum, so the S1. And then we go all the way down to that little depression, which is the tailbone or the coccyx. So we know that if this is upper body, this is lower body, the spine's up on the side of the foot. What I would have done inside of a session that I was already doing the whole reflexology routine to cover the whole body, I would have already worked up the spine and down the spine, affecting the spinal cord for nervous system. I would have worked along the spine for musculoskeletal system. I would have been specific. And had I done a whole session, I would already have found some tender areas and I would have charted them. So when we talk about tender areas in reflexology, what it means is it's the body's way of telling us, come work here. It's the body's way of telling us there's an imbalance there. And that's where it wants a little more attention, a little more pressure, to see if it can tune into itself and if it's got the resources it wants to self-correct. Okay, so I'm going to start working along here. Michael, can you just tell me when I am working on something that's more tender or less tender? So if I'm just starting right at the tailbone here and catapulting up like this, we're doing a very specific and deliberate climb up the spine. And you let me know where it feels a little tender. So right in here. And I'm going to keep going, and you tell me where it continues to be tender. Okay. Is it still tender?
Yeah, you bypassed it.
Okay, so then it became less tender?
Yeah.
Okay, so let's go back and find it again. So you just tell me where it is one more time.
Okay.
Yep, on it?
Yeah.
And then how long do I stay on? Am I still on it now?
It's just a little bit more to the top. There's a spot right there.
Right here.
Yeah.
Okay. And so we actually really closely defined where the most tender spot was. And you did have a little jump response. Now, jump response is not the goal for your clients. You don't want your clients or even yourself or someone in your family, you don't want them to jump from pain, but occasionally that might just happen. You know you found a spot. I lightened up a little bit, but I still am maintaining some pressure. So the idea here is, as long as Michael can relax his body, whether it's consciously and he has to actually think about it, but if he can deep breathe and his muscles are relaxed and his fist isn't tight, and his jaw's not tight, he's not holding himself on the table, as long as he can sink into the table, we can cooperatively work on a tender reflex. So since I just went up the low back, I found a spot that is tender. It is actually very close to that navicular bone that I was telling you about. So it's like really kind of like T12L1 area for those of you who are interested in exact locations. You don't need to. Really, the bottom line is find where it's tender and start working. Now, how we would normally work in reflexology, we've got a couple of techniques that we generally use. One is the thumb walk. One is just rotating on a medium-sized reflex, and one is hook on a tiny reflex. So those are pretty consistent across most methods of reflexology. But when you're doing treatment strategy for something and you find a tender spot, you're not restricted to only doing those things. You can open that up and do different things. So I'm going to do what's called a pressure glide, and I'm working over that area. I want to keep watching my client's body and just see if there's any signs of tension, if he's tensing up his face or his jaw or his fists. He's breathing deeply. So even though I am guessing, is this a little tender, Michael? Okay, so he can feel that it's tender. I also can feel like a magnetic pulling me in. So I can kind of energetically feel when the reflexes are congested. Some people naturally can do that, but we can also train people to feel that. Or if you don't feel that at all as a practitioner, it doesn't matter one little bit, your client's going to tell you when it's tender or where it's tender. Okay, so I'm still doing pressure glide. I've shifted my position a couple times. I switched my direction. I was going up and down. Now I'm kind of going across it. Okay, and once I've worked that for a few seconds or a minute or two, I'm going to just do an energy release. You just kind of rub it out. And any congested energy that now may be leaving that area or moving along through any of the energy processes of the body, like meridians or through the nerves, sending signals, or releasing through the energy field, or even if you don't think any of that's happening, but it's just something that feels nice after something was tender and a little on the painful side, we're just kind of going from specific to general, letting that release, and then we can move on. So I'm going to go back to the beginning of low back. I'm just going to make sure that I'm working this whole area, not just one little tender spot. So this is all from the navicular bone down. That's all lumbar area. And I'm making sure I go broadly along lumbar. And I can even bring my thumbs onto plantar. And what I'm doing here, I'll just show you on this model foot. I was just working on the inside spine. Okay, I was working the lumbar area and the sacrum and the coccyx. And now I'm going to bring that over onto the lower arch because all of the muscles that go from the spine across the low back are in this area. Okay, so that would be like quadratus lumborum for anyone who happens to be a massage therapist or follow muscles or yoga practitioner, Pilates person. So in any case, I'm moving across the bottom of the foot. You may know this if you are a reflexologist and if you see a reflexology map, it's also the reflex area for small intestines. But remember that reflexes are always stacked. So there are always multiple reflexes in any given area, exactly as if there was a laser that was pointed at a part of the body, there would be several layers of body parts and organs that that laser would touch if it went right through the body. So same thing for reflexes. So now I'm altering again my technique, and I'm imagining that if he's saying his low back is tight, even down to the top of his hips, then here we are below the waistline, which I'm gauging by the fifth metatarsal on the side of the foot. We are in the lower body. I'm working the muscular reflexes, plantar, and I did go across like this, and now I'm just going to shift my direction, and I'm just going to start dragging my thumb down. Okay, and I'm also just moving the foot into flexion at the same time, and this is just giving those back muscle reflexes a really good workout. And now I'm going to go across them again. And you can do reflexes, like, remember that absolutely anything that exists in the body will have a reflex, whether it's on a reflex chart that you've seen or not. Anything in the body that exists as a body part will be found in the feet as a reflex to that body part. So when I'm working along these muscles, I am imagining that fascia could be part of this, and I could be connecting to the fascia reflexes as well. Every time we're doing this, we're just talking to the body with our hands and saying, hey, buddy, how are you doing up there in the low back area? Is there anything that you can fix? Okay, and we're giving the body a chance to focus on itself and make changes if it's got the resources to, which it often does. Okay, so now that I've worked on that, and I'm just going to do a little bit of an energy release, I want to draw our attention to a second spine reflex. And the second spine reflex actually runs up the Achilles tendon. It actually goes all the way up the leg. But the useful parts for us to work on, where they're small enough and they make sense, is the Achilles tendon as representing the low back. Okay, so if this is low back and this is low back, I want to make sure that I'm working both of them. And what I can do here is find any tender areas along that Achilles tendon that will be the body's way of calling me to that particular area and help me release that tension or energy blockage. So Michael, can you help me working along here?
The upper part right there.
Okay, you already felt it? Yeah. So let me just glide up. So here's the lower part of the Achilles tendon, and I'm more medial and I'm moving up. And you tell me where.
In that area there.
Right in here? Yeah. And if I keep going, does it maintain tenderness or it gets better?
It sort of maintains, it stays a steady
tender all the way up? Yeah. Okay. And if I move a little bit more towards the back of the leg, what's that like back there?
It's less.
Okay. And if I go directly to the back, I'm like right in the center of the Achilles tendon.
Yes, sir.
Okay, and I'm using the same amount of pressure. And now I'm going to go to the other side. Lateral, what's it look over here?
More than the second place that you hit on the other side. It's lesser.
Okay, and I still just keep going up laterally. Okay, so this is the most, and then over here is the second.
Yeah.
Okay, so I'm going to stay very close. I'm just going to follow the Achilles tendon very close to the leg. Really close to the bone. So I'm really feeling up along the inner edges of both the tibia and the fibula, the two leg bones. I'm going all the way down to the ankles and then just gliding up. And you had said it's pretty consistent, the same degree, exactly where I'm working all the way up. Okay. Okay. And are you still breathing nice and deeply? Are you actually able to keep your body relaxed?
Good.
You feel? You good? Okay. And if your client was defending, what that would tell you is that you're popping back out of parasympathetic nervous system, which is rest and repair. Right? So we really do want to get our bodies, our clients' bodies, or use reflexology in our own bodies into a state of relaxation where it does its best healing. That's why it's earned the nickname rest and repair, which means we really don't want to ignite that stress response. Okay, every now and again, a jump response might happen when you're locating a reflex. You're not going to work at that level. So once I stimulate both sides of that Achilles tendon close to the leg, I can kind of change it to a little bit of a diagonal and move back, more back towards the posterior or the back of the leg along the Achilles tendon. And I can also do a nice little loosener right here. So I can just go back to some of my techniques that I already know from the session. Do a little bit of a loosener, which is also accessing, loosening the low back by the reflexes. You can do a little bit of movement of the ankle itself. The ankle represents the groin area, and there's hip reflexes all the way around. And now that I've done that, I'm going to actually move on to the lateral hip. So let me show you what I'm going to do, because it's going to be on the other side and you're not going to be able to see it. There's like a little half moon shape around the lateral ankle, or you call it lateral malleolus. This is the lateral hip. There's also a little half moon shape around the medial malleolus or the inside ankle, and that's the medial hip. Okay, so medial hip reflex and lateral hip reflex actually refer to, the medial hip reflex is more like the SI joint where the hip connects to the sacrum, and the lateral hip reflex is where your thigh bone, your femur, connects to the hip bone. Okay, so I'm going to work on the other side, and I'm going to work on the other side and just glide up into the reflex area and pressing in the actual crease of the ankle itself. So here's where I'm pressing. If I was to bend the foot up towards the client's head, or if I was to side bend it outward, this little valley or this little crease would show up. It would be a little bit more distinct. And this is the crease of the front part of the hip reflex. It also happens to be a sciatic reflex. So if your client did have sciatic problems that were related to low back problems, then that would also be an area that I work anyway. I would find a little tender spot in here and I could hook it or work it more specifically. And I can do the same thing around the back. So this is the area that I'm going to be working. And what I want right now is, I'm curious, Michael, can you feel when you're lying there, do you notice if your hip feels tight or different than the other side at all? Or it's okay if you don't, I'm just curious.
My left side feels tighter than the right side. It feels drawn in a bit more.
Okay, it feels drawn in like towards the central line of your body, like tighter to the spine,
It's pulled up.
And pulled up towards your abdomen.
Yeah.
Okay. So, and just feel your right hip at the same time. Just see if you can kind of have a really good comparison. And I'm wondering if you can kind of like snapshot that sensation. Trying to remember what this feels like now.
Okay.
Because as I'm working directly on the hip and involving the low back and the spine, I just want to see if there's anything that you may notice actually during the session while working. And to everybody else, this is a bit of a trap if you're a reflexologist who expects clients to feel something right then. They may not. So it's okay. And sometimes when you're doing reflexology, your clients will actually feel worse before they get better or feel better. It appears as though symptoms get worse before they get better. And that could be called a health crisis. It's normal. So it would be entirely fine if my client said he actually felt a little tighter than when he first came in. But I'm betting within a few hours that would release. By the next day, it might be completely released, or by the next session that we have. Okay, so don't worry if that happens, and it does not mean that reflexology failed, which is also what I need to tell my client. Don't just say what you think I want to hear, right? Your client should never tell you what they think you want to hear. They should be radically honest about their bodies, which helps you develop your treatment plan properly, which helps you know if you need to see them again, which helps you track exactly what changes are happening. So that's what we're going to do this time. We're going to continue to work on that hip for a few minutes. Now I can do things like a sustained pressure. I can do like little tiny pressure glides at all of those little spots along the hip reflex. I can side the foot laterally, and we just found quite a tender area, and a jump response tender area. So I'm going to go a little bit lighter on that one, Michael.
Yeah.
I just lightened up.
That's
Okay, are you totally relaxed?
Yeah.
Okay, now you tell me. I'm going to actually just gradually increase pressure. Yeah. And you tell me where your limit is, where you are still completely just relaxed on the table, even if consciously. So here I'm coming in a little deeper. We're still good?
You're at the spot.
I'm on the spot, so you can feel them on the spot.
That's what
And that's where you can stay relaxed. So take a nice deep breath. And let's say I'm just going to hold this for about 20 seconds. Does that sound okay with you? Okay. So everybody else, if you happen to be working on yourself right now, see if you can find a spot either on the spine or hip reflex areas, if those are areas that are affected. And just see if you can find a spot that's tender and challenge yourself to hold it for 20 seconds with pressure. And so it will feel uncomfortable if it's imbalanced, if it's a sensitive reflex. But challenge yourself to relax the entire rest of your body and see that it is actually possible to be relaxed while you're cooperatively working on a tender reflex. So I'm easing off of that now. I'm just releasing the pressure. And I'm going to do what I did before, just like a quick little rub of the area, like a little energy release. And I'm going to go back to some of the reflexes I did before, and I'm just going to recheck them or just re-stimulate them. So I'm doing low back along the Achilles. I'll do the low back muscles, the lower arch. And I'm going to do the spine reflexes at the base of the spine. Okay. Now, one thing that we can do in reflexology as well is called working in a referral area. And what it means is that in reflexology, the body has a buddy system. So that if there's another part of the body that's similar in form and function, if they have things that are in common, they probably like to help each other heal. That's the theory behind it. So what we're going to do here is imagine that the upper body and the lower body relate to each other as referrals. And so if I work the low back, the corresponding referral area is going to be the neck. So that's where I'm going to go next, not because of the neck, but actually in support of the low back. So I'll also do some work along the neck reflex, which is up in the toe. And again, I'm just doing a pressure glide. I can do some twisting. I can do a little bit of traction or pulling, twist and tug for the toes. And it's almost like if I hold this part of the foot stable and then I pull on the toe, it's like I'm holding the mid-body stable, that's the reflex for it, and then distracting or drawing the neck. And so I want to be able to distract or create some space in those neck vertebrae via giving the body a signal through the reflexes. Okay, so I'll work all around the neck. And then I can also work on the little toes, which are extensions to the neck. And now if I was working specifically on the neck, as in for a whiplash injury, I'd probably be way more specific. But I'm doing it in support of the low back. So I'm a little bit shortcutting it, just saying hi to all of them so that the body gets the message that it can correct what it can. It's got the resources. The body is second to just pay attention to itself. Okay, so we are assuming that I already have done the whole routine, which means I would have already done the right foot and I would have already caught reflexes on the spine in the right foot. So what I'm going to do is actually carry on and add in a few extra reflexes that are going to help with this based on pain relief and inflammation relief if there's inflammation involved. If you've just joined us, what I'm doing is a demo routine to work with specific health conditions. And today I've got a client who came in with us who talked about having low back tightness and hip tightness, particularly on the left side, as well as some pectoral tightness, which we haven't yet gotten to, but we will. So I'm just showing you what I would have done following a whole session routine, where now I'm going back and focusing on key reflexes. And then if you have something happening in similar areas, you can work along with us. We could just as easily have had a client who came in talking about a problem with the hormone system or endocrine reflexes, which is what we would have approached with that. We could just as easily have a client come in who was going through cancer treatment. We could have had a client who come in who has irritable bowel syndrome. So anything to do with organs would also be a valid health goal for you to help work with. This happens to be more on the structural side. And so we're going to work the structural reflexes, which mostly takes us into the musculoskeletal system. But right now I'm branching off from that and I'm going to work some chronic pain reflexes. So everybody can pay attention to this, whether you're a practicing reflexologist or not, because you can use these chronic pain reflexes for yourself or for any client, even if you're a massage therapist, a physiotherapist, a chiropractor. These are just extra little buttons, little magic buttons that help actually decrease pain in the body. So the one we're going to start with is going to be the pituitary reflex, and it's the center of the big toe. So here's the big toe. Here's the center of the pad of the big toe. It's on both sides. So I'm going to find the center of the pad of the big toe on both sides. This specifically is for pain relief. It's like taking a Tylenol. So what I'm going to do is press into that reflex. And Michael, I'm going to press fairly deeply here. So you let me know what your tolerance level is and if that feels okay. Is that all right? I'm using pressure with my thumb, counter pressure with my fingers. I'm really squeezing it. I can see that it's kind of gone white, and so have the tips of my thumbs, so I know that I'm using pressure. It's a little bit of tissue deformation, which means there's a little bit of a dent in there. So I'm really pressing into that pituitary reflex, which will hopefully trigger the body into releasing endorphins, creating a pain relief effect. And when you're working this as part of your treatment strategy, you can hold it for 20 seconds, you can hold it for 30 or a minute even. When I come back off of that one, that's one that you can go back and rework anytime. I could be doing a treatment strategy. I'm going to do the pituitary reflexes for pain relief and then carry on my treatment strategy. And then a couple minutes later, go back and do it again. And then carry on with something else and go back and do it again. So there's always the option to go back and work on the pituitary reflex as part of a pain relief session or strategy. Another pain relief reflex is at the top of the foot. And it's actually, if you go about an inch down from the webbing, and then your finger will fall into a little hole just below the first knuckle, so between the first and the second knuckle of the foot. You may know this already. If you know reflexology, it would also be a lymph drainage point, but it's also just a chronic pain point. It's a pain relieving point. Another word for these points, if you're looking them up at some point, might be analgesic points, but it basically means it's helping the body deal with pain as if it's taken a Tylenol or some kind of component. So press into that one as well. I can press and sustain. I could even rotate. I could pulse. So you have a lot of options. I could even use something like a knuckle versus the finger. Okay, if I wanted to do them one at a time, I could. If I wanted to do them both at the same time, I can. And my position really isn't based on any like exact technique. It just means get in there and work it somehow. So if I'm comfortable, if my client is comfortable, I'm on the reflex and I'm getting the work done, then it's right. Okay. And then we track, did it work? Did it have an effect? If it did, great, we'll carry on, do more of the same. And if it didn't, we're going to start to experiment. And as long as I can rationally explain why I'm trying a certain reflex point and therapeutically it makes sense, it's not wrong to try it. And we're seeing where the body's got the resources. Is there tender there, Michael? One more than another?
Both the same.
Both the same, quite tender? Okay. Okay, so now I'm going to show you another chronic pain point. It's the base of the toenail. So if you just go on to the flesh part just underneath the toenail, so it's kind of just below the cuticle, and again, you squeeze on that. That one's going to be fairly bony. It's not a lot of padding in there, so it's pretty close to the surface. What does that one feel like, Michael?
That's the other one.
Okay. So this level's okay of pressing, and okay. So again, I'll just hold that for a number of seconds, whatever that might be. And remember that all of those you can come back to and rework when you want to. So those are 3 pretty awesome pain relieving points. If you're working on yourself or if you move up to hand reflexology, the reflex point that's at the top of the foot right here is also related to this point between the thumb and the index finger. So a lot of people know this when you go down from the webbing into the fleshy part of the hand, and basically you feel around between those 2 bones until you find a little tender spot. There's a little nerve plexus in there as well, just in terms of anatomy of the hand. But that's an energy spot for pain. It's for nausea. It's called the happy point as a nickname because it has a whole lot of applications. So this is also a pain point. If you ever get a headache and you're on your own in a grocery store lineup, etc., this is what you can do. And just remember that in terms of hand reflexology as it relates to foot reflexology, these 2 points are the same. They have the same effect. Okay, so I'm going to move on to doing some anti-inflammatory points. I'll show you some inflammation relieving points just in case inflammation is part of a condition that you're treating. Inflammation, when you hear the name of a condition and it has itis on the end, I-T-I-S, that means it's inflamed. So there's inflammation involved. Now, not all inflammatory conditions are called itis at the end, so there's a whole bunch of other stuff that may not be called that, but they do involve inflammation. But I'm going to assume that most reflexes or most conditions that actually involve pain may have some form of inflammation. So I'll give you some example of some itis names. Arth means joint, so arthritis is inflammation of the joints. Tonsillitis, tonsils, inflammation of the tonsils. Bursitis, a bursa is like a cushion pad in some of the joints, so inflammation of the cushion pad in whichever joint, right? Shoulder bursitis, hip bursitis. So any itis, you know you're going to work these following reflexes. I'm going to start with actually working on the adrenal reflex, and we often relate to this one as related to stress. It releases adrenaline, but it also releases cortisol, which has a role in managing the inflammatory response. So the adrenal reflex, so that you can find it on yourself or someone in your family, if you drop down from between toe 1 and 2, the big toe and the second toe, follow that webbing and go all the way down in a straight line, just through the ball of the foot and immediately under the ball of the foot, but not touching the ball of the foot. In reflex terms, you're just beneath the diaphragm transverse division, but not touching the diaphragm. This is where the adrenal reflex is. It's relatively small. What you can do to find the adrenal reflex is it's usually just a little bit more tender than the tissue that surrounds it. And maybe that's because a lot of us have some adrenal imbalance. We have some chronic stress in our lives, so maybe it just tends to be a reflex that, more likely will be imbalanced. Or maybe it's because a lot of us actually have inflammatory problems within the body, inflammation that's related to health problems. So in any case, I'm going to go down between zones 1 and 2, just below the diaphragm line, just below the ball of the foot. And Michael, can you tell me where it's a little bit tender in through here? Any tenderness in there? Okay. And I'm going to do it on the other side as well. Can you tell me for the other side where it might be a little bit tender? Maybe there's no tenderness. What's it like in there?
It's not too bad.
Okay. Is it more tender on this side?
Yeah, it is for some reason.
Okay. So I'm actually going to work both of them, but then I'm going to favor what his body is showing me, and I'm going to go follow where it's most tender. So I'll work the adrenal on the left or his right side a little bit more than on the other side. So I'm going to start with both. So I'm just going to hook both of them at the same time. And if there is an imbalance within the adrenal glands, which are responsible for producing adrenaline or epinephrine and noradrenaline, and also cortisol, then hopefully that's going to support it so that it now can do a better role in relieving inflammation. And I'll come back over to the foot where it was more tender, and I'll spend a little bit more time in here. Is that okay for pressure?
Yeah.
So can you, could you help us out just for people to understand how much pressure, what does this amount of pressure feel like to you?
It's not to the full. It's about 3/4 what I can tolerate.
Do you want me to press harder?
You can go a
A little deeper? Okay. And what do you think the physical sensation of that pressure is? Could you describe it?
I wouldn't say a burning sensation, but it's more of a dragging, constant pressure all the way through.
And you are able to keep the rest of your body relaxed?
Yeah.
All right, so I just worked that for a number of seconds. I really did get right in there. He could feel it. He could feel like it was burning, but he could stay relaxed. And so he was guiding me saying that's about 3/4 of where you could go, where I can still stay relaxed. And I did go a little bit deeper there. And that's the one that was more tender than the other side as a adrenal reflex. So I made sure I worked both of them really well, but I came and did the one that was tender a little bit more. The other thing we can do in support of inflammation, and especially if there's any swelling. So now he's not reporting any swelling. He doesn't have a swollen hip joint or doesn't have any edema at his ankles. But if someone was reporting swelling along with inflammation, what you could do is work through the lymph reflexes, which are the valleys between all the long bones in the foot. And you could work that lymph drainage point, which we just worked for pain relief. It's the same point. So we could go down all those long lymph channels. You could finger walk like this with your thumb, with your finger. You can glide. You could grab it with all your fingers and work through there. But somehow work down all of those pathways, and those are the lymph channels, and around the ankle, which would be groin lymph, and the lymph drainage point on the top of the foot. So I can do that on both sides. Work down all the lymph. And the final key to that piece when you're working lymph for inflammation and lymph drainage to help drain that inflammation from the body, the final key to that is working the kidneys, which will literally flush out excess fluid from the body if it was created from inflammation. And the kidneys are going to be located below the adrenals. So I haven't shown you a whole lot for reflexes on the map. I'll take a break and show you a few of those reflexes so you can see where they are. The maps are available everywhere, so you can really just pop online and probably see 100 of them. And I'll show you ours in a second. But the kidneys are going to be between zones 1 and 2, or again, if you drop down from the webbing between the big toe and the second toe, and then you're just about the middle of the arch, a little bit higher than the middle of the arch. And that's kidney. Okay, so kidney will help flush excess fluid from the body, especially in the case if there was excess inflammation and the lymph was pulling the excess fluid from the tissues that are swollen, dumping it back into the blood, and the blood filters to the kidney, and we eliminate it via the urinary system. That's really the whole cycle of that. Okay. All right, let me show you what I just worked on. Right now, I just did the adrenal gland for inflammation. I worked on the lymph channels to help move any inflammation out of the body, as well as lymph drainage, and I did groin lymph as well around the ankle. And then we worked on the kidneys, and there are 2 of them, one on the right, one on the left. Oops, sorry, kidneys up here, to help flush any excess fluid from inflammation. Okay, so Michael, do you want to just check into your hips right now? And it doesn't matter what you say, so just say exactly what's true about your body. Does it feel worse, the same, or better?
I say my left hip is settled a bit into the table a bit more.
Settled into the table more?
Yeah.
Okay. So what does that mean? You had said it felt like it was tighter to the spine and tighter up the body?
It's less tight.
Okay. And if you had kind of a comparison of an irritation or pain level from before to after, about what percentage improved would you say that is? If it is.
Yeah, it's just I'm more sound at the table. I don't feel it's tight in the upper part of my upper hip. So
Okay.
as far as the number,
Yeah, that's okay.
it's just less.
Sure. Okay. All right. And sometimes what I'll say to try and get a gauge from clients, just if I'm trying to understand. So what I'm getting here is it feels less tight, especially at the top of his head. It feels like it's settled more into the table, which tells you the muscles have probably relaxed and they're not holding as tight. I could say something like, you know, does it feel like it might be 10% improvement, 50%, 80%? I might kind of give someone a bit of range just so I know if I'm close. If he didn't say there's like this gigantic improvement, it all feels perfect. He just feels that it's softened somewhat. And so that could tell me I could do a whole round again of what I've done, or we could actually wrap it up and then he could go and he can go back for a different session and see what he feels like later in the evening and tomorrow, and we keep up the work, right? And remember that anytime the body has gotten itself into a condition over time, if it's become somewhat chronic, then it's going to take some time to back the body out of that as well, because it's using its own inherent resources. We're just stimulating self-healing through reflexology. So what I'm going to do now is just move on to working the pectoral area, which is the second thing that he had let me know was bothering him. So goal related towards pectoral area, I want to explain the muscle reflexes because they're a little bit different than what the other ones look like. If you look at the chart, you will see that from the toes to the heel, if this is head to pelvis, it's like you're facing someone head on. If the 2 feet were together, that would be the whole body, right? And so there's a little bone on the side that sticks out. That's the fifth metatarsal. And that gives us a waistline reference, which means all the organs above the waistline in the abdomen or in the arch, all the organs below the waistline in the abdomen are in the lower arch. So upper arch for upper abdomen, lower arch for lower abdomen. The ball of the foot is actually the chest cavity. So anything that's up inside the thoracic area, the chest cavity, like the heart, like the lungs, bronchial area, and including that whole shoulder girdle all the way around the body. So the shoulder joints are here as well. So this is kind of, you know, head and neck at the toes, chest and breast at the ball of the foot, and the whole abdomen is divided into upper abdomen and lower abdomen by this bone on the side, and then we have pelvis. It's like you're looking at someone head on. They're facing you. You see them from an anterior or front perspective, but you have x-ray vision and you can see inside their body and you see their organs. The muscles are actually a little bit different. When we're working on the musculoskeletal system, instead of the 2 feet being the whole body together and I'm looking at it head on and I have x-ray vision inside and it's like it's looking back at me, the anterior or the front of the body, for the musculoskeletal system, we're going to flip that perspective because there are different perspectives in reflexology that all exist together. It's easier to find, certainly the muscles of the back, when the sole of the foot or the plantar aspect is representing the posterior body or the back muscles. And we did actually do that when we were working on the QL muscle or the muscles of the low back between the lower ribs and the hips, and we were working that in the lower arch. So if this is the back of the body, plantar, or from the sole for the musculoskeletal system, muscles and bones, then the front of the foot is going to be the front of the body. So this now becomes anterior view for the muscle system. Okay, so surface muscles, which also, you know, the breast is there as well as a surface organ. So what I'm going to do for pectoral muscles is the pectoral muscles are your upper chest muscles, go onto your shoulders. Okay, so here is the upper chest right here, chest and breast reflex. Its ribs are in there as well, breast is there as well. And so I'm just going to start feeling along this whole area. And I'm going to get Michael to reflect back to me when we arrive at some tender areas, because they may be anywhere in through here. I'm not exactly sure where they are yet. I just know this is the general area where I'm going to find those upper chest muscles in the upper chest reflex for the pectoral area. And Michael, I forgot to ask you, I don't know if you told me this, but for your pectoral muscles, is it worse right or left, or are they both the same?
It's the right side, and it's tight. It's pulling my scapula, like pulling my scapula.
It pulls your shoulder forward.
Yeah, rotate my shoulder forward, which is causing my scapula to pop out more in the back.
Okay, and it's on your right side.
Yeah.
So for, if you haven't caught on to this part, if I'm working on his right side body part, I'm going to the right side reflex for that body part. Okay, so same side of the body, same foot as a reflex representation. So I'm going to go to the top of the foot, And I'm going to start just kind of going from medial to lateral, from the big toe out towards the fifth toe, and glide along what would be the pectoral muscle as a reflex. And I'm going to switch it up and keep moving in so I can get all the little bits, make sure I'm touching everything. And Michael, is there anything that's identifying itself yet?
But just as you started, and you were right on the spot really quickly. It was right at the beginning.
So it's more out here.
You're right in there.
Okay. And is it still?
Yeah, it is.
Okay. And if I keep going out towards the side, what's this like?
It's lessened up to the side.
Okay.
In that area there.
And move in again. Okay, and now I'm just going to do a little bit of an experiment. If I keep going on to the next spot, if I keep moving towards the center of the body, what's it like in here?
That's about the same still.
Still pretty tender?
Yeah.
Okay, and what about in through here?
It's eased up a bit.
Okay. All right, so based on just searching for where the reflex is tender in the upper chest reflex, what we're getting is over toe 2, over toe 3, and toe 4. Sorry, not the toes, the actual metatarsals, the long bones in the front instep of the foot, where the chest reflex is. It's these 3 areas or zones or lines below the toes that I end up working on. Let me show you that from a bony perspective. So here's the bony foot. If we're using bony landmarks for the reflexes, this is the top of the foot. Here's the bottom of the foot or plantar. Okay, so top is dorsal. This is the big toe. You can see that the toe bones are bigger. So what I'm actually working on in here is I'm following the bones and between the bones. And we know that between the bones is lymph, but it's still the chest area. It never wasn't. There's a lot of overlapping happening. So I can work between them. I can work on the bones, then between them, and then on them. And what Michael's identifying is that when I actually go onto the top of each of these metatarsals, in this case, it's metatarsal 2, 3, and 4, which is where the upper chest reflex is, that's where he's feeling the most tender, okay? And it's reflecting his right side for his right pectoral area. So that's where I'm going to focus my work. And again, a whole session wouldn't be sore like this. A whole session should feel nice with some tender reflexes. But because if you've just joined us, we're just doing the actual treatment plan part. Let's assume we've done the whole reflexology session and now we're just doing treatment plan for relevant reflexes that actually are problematic. These ones probably all are tender. And this part in a real session would probably last about maybe 15 to 20 minutes. And then you'd wrap up with a really nice relaxation massage at the end. They would go home and they'd come back for a different session later if necessary. But since I am focusing on this kind of in a teaching video, we are working on these a little bit longer than normal. I really am trusting Michael that he's going to tell me if he starts to feel tense so I can ease up if it's becoming too much. I can see that he's still breathing. I can watch his abdomen. I can see that he's not tight in the face or in his, actually I can't see his hands, I've just been asking him, but I could watch his hands. And the whole time we've been doing this, I've still been working on these tender reflexes. Now, if you are working for the first time ever by just exploring your feet and finding out where you have some tender spots and stopping and massaging them, that actually is reflexology. Okay, so you are doing reflexology, it's just that some parts of the feet represent some parts of the body. The more you know the map and you can really think about it as an actual little body, not just shapes and blobs that represent something that you can study, but you can really find things that are unique to that exact person, like their scar, right? Or they might have a particular thing with their body that nobody else does. It would be in their feet as their own reflex. And that's how well you can learn it. You can really learn it as a body, not just as, you know, kind of a methodical colored map. And the other thing is, once you progress in reflexology, some people naturally have an energy field, some people may not, but there are energetic principles and ways of palpating or feeling into the reflexes that you actually can tell when a reflex is tender if your client didn't tell you that. How are we doing there?
Yeah, tender right there, that's fine.
Yeah, is that kind of the worst one so far?
Yes, that's right.
Okay. And so I'm actually going to ease up just a little bit. Is that good? Just like that? And can I go a little bit deeper?
Okay.
What's that like? Just like that?
Yeah, that's good right there.
Okay, and what I'm still going to actually, he just said it's good, but I'm going to slightly ease off anyway, because I think involuntarily his foot just had a few little jerks. If you didn't notice that, I could feel it. So I eased up just a little bit just to make sure the body's not in defense. But I can also tell that that's a spot that's really kind of drawing me in magnetically. It's just an energy sensation of congestion within the reflex. So it is possible to learn how to feel those. And I'm just holding it. I'm just doing a sustained hold on the reflex, which is like just a way of sustaining attention and allowing the body to focus on itself and see, is there something I can do up in here? Do I have the resources to heal something? Can I bring more blood flow to an area? Can I bring more oxygen? Could I bring more nutrients and drop those off? Could I clear away some waste out of this area, right? So can I just relax the muscles? Can I become aware that I'm holding them tense and just relax them? So these are kind of what the body has a chance to filter through as it checks on itself to see if it can self-correct. Okay. How are you doing up there? Are you feeling any tightness right now in that right pectoral area?
Just a bit. I'm kind of stationary, so it's kind of hard to tell. Other than my scapula is out against the table, so that's how I know it's kind of.
Oh yeah, you can feel the back of your scapula poking at the table. All right.
It's a small rotation of the forward shoulder.
Okay, so he's telling me about his pectorals being tight at the front and pulling the scapula so it's kind of popping out of the back. That's a very common pattern within the body. If there are tight pectoral muscles that are pulling the shoulders into a rounded forward position, and in Michael's case, it's one shoulder in particular that's doing that more than the other. What it's also doing by default is it's actually pulling these muscles between the scapulae and the spine. It's pulling those taut, which is like they're too pulled tight of an elastic and they get a little bit skinny and a little bit tight. So typically a tight muscle means that the muscle itself is shortening and pulling, the contracting, pulling, and it's stuck in that contraction kind of tightness. But tautness means it's stretched too far, not pulling in. So that's what generally happens in that kind of patterning around the body is if one in the front is short, the one in the back has to be too long. So since he feels his scapula poking into the table, I'm going to now work on the scapular reflex. And I want to show you again the chart. So here's the chart which shows us that the shoulder is in zone 5, or another way of saying that is the outside of the foot, or another way of saying it is under the pinky toe. Okay, so on the ball of the foot under the pinky toe, that's the shoulder joint. If this is the shoulder joint, and this is the arm that drops down below it, represented as reflexes, then what would happen here, which is not shown on the picture, is the scapula would come across the ball of the foot like this, with the muscles between the shoulder blades going between the scapula or the shoulder blade and the spine. Okay, so those muscles between the scapulae would be like rhomboids or mid-traps. And so that's an area that we could also massage, not because they're too tight, but because they're taut. Right? So we want to, everything about reflexology is about balance. I don't have to decide which way I need something to go, whether I need it to get, kind of falling back into its regular form, or if I need it to loosen up and stretch out. I don't actually have to decide that. I just have to stimulate the reflex area. And the body's going to check into itself, become aware of what it's doing, and do what it can to self-correct if it has the resources. Okay, so right now I'm just working on the muscles between scapula and spine.
That's tender as can be right there.
Quite tender. Okay. And now I'm going to work through the entire ball of the foot, which is the shoulder blade itself. Remember that everything's superimposed in reflexology, and for musculoskeletal system, you can flip it around so that this is posterior or the back of the body. But the other things that exist in here at the same time as reflexes would be chest, lungs, heart, bronchial area, esophagus is in there. Diaphragm is at the base of the ball of the foot. So there's a bunch of other stuff that's in there too. Okay, so I'm just going to cross this as the scapular reflex, and then working through there again. And you can also do something that's a little bit stimulating, like a little bit of tapping or a little bit of tappement. So you can come away from your typical moves in reflexology that you do in your session to be creative about how you work the reflexes for the key or target reflexes related to a condition. Okay, I can do an energy release along there as well. And one thing I forgot to do, this is actually related a little bit more to the low back complaint that he was talking about earlier, but I could also work on the diaphragm reflex, which is really great to do for any low back tightness, because if the diaphragm is also tight, then the two anchoring ligaments that actually attach the diaphragm to the spine, they attach in the lumbar region. So the two long kind of muscular turning into ligaments that attach to the lumbar spine, if those are tight, they're also pulling into compression the lumbar, And seating and gravity or whatever else might be pushing that into compression as well. So it's kind of like compressions coming from the top from the diaphragm and from the bottom from seating and gravity, etc. So any low back thing, it would be helpful to work the diaphragm. So I'm just going to take a couple seconds and work the diaphragm as well. And here I'm again just reverting to a pressure glide. So it might really appear as though reflexology is more like a foot massage, but it's different from a massage because I'm not just accessing the structural parts of the foot, like the muscle, the tendons, ligaments, fascia, skin of the foot. I'm not just locally affecting the foot and circulation to the foot, although I am, but not just, because what else exists in here are the reflexes, which are just they're like little energy buttons that do relate to other parts of the body, and they trigger an automatic response in those other parts of the body through some mechanism of action, which probably has to do with the nervous system and some energy systems of the body, like meridians perhaps, or zones. Okay, so I just worked on that diaphragm as well. I'm just going to loosen up all of the bones of the foot, but I'm doing it again from the reflex level because I'm thinking about loosening the scapula so that it can just glide across the rib cage as it should. And so that those muscles between the shoulder blade and the spine can go back to their original position. Right? Let more circulation in there, more nutrients, bounce back from being overstretched, and let the scapula lay where it should lay. Okay, so now remember that Michael doesn't have to feel a difference from this right away. Some people may immediately, some people might take a day, some people might take several sessions. And for some people, it dips first and then gets better. And it might appear to get worse before it gets better. So I'm not expecting a particular answer, and he can answer completely truthfully no matter what it is. So right now for your scapula, Michael, how does that feel against the table?
It's released a bit. It's not as protruding out onto the table. So it is soft up a bit.
Okay. Okay. So what we ended up doing today, then, what we managed to work on, we worked on the left side of low back and hip primarily. We worked on right side for the pectoral muscles that affects the shoulder blade as well. We did feel some softening and softening into the table for the hip, that it kind of let go of some of the tension. And we also felt like there's some not as poking into the table. Is that right? For your scapula? Okay. All right. So what you'll notice here, which is important, reflexologists cannot overclaim what they can do. Sometimes amazing things happen that appear to be miracles, and people jump up off the table like, oh my God, I've never felt so good. Nothing else has worked like this for me. I don't have any symptoms like after a session. But that's not the norm. The norm is people usually have longer standing problems when they come in. It's going to take time for the body to work those back out again with the proper kind of support. So what happens more often than great big gigantic miracles, although we leave room for those, what happens more often is a very methodical approach that time after time, things get a little bit better each time. And sometimes you may actually see a client where symptoms appear to get worse and then get better. And I don't want anyone to be afraid from working with reflexology based on those being very real parts of what a reflexologist might experience with their clients. What we should do instead is we should educate our clients. We should have a very open professional communication track so we know exactly that it's safe to say anything. Nobody should be trying to impress their therapist but then not go back because it didn't really help. And then as we follow and respect what reflexology can do, which is support the body as self-healing, recognize it may take more time, but if the body heals itself from inside versus, for example, having maybe a cortisone shot, maybe the cortisone shot will work very quickly and release symptoms right away, but it could also, the problem could also come back or manifest differently down the road. If the body heals itself, okay, the disadvantage is maybe it's going to take longer. But the advantage is it's probably also going to hold longer because the body did its own self-correction. So reflexology is not a really fast approach. Sometimes it is. More often it's slow and steady. We may have to adjust our treatment plan. We may have to adjust the key reflexes that we work. I may have had a client come back and say nothing really changed. So we can adjust it a little bit and see where we might focus. I could potentially have focused a lot more on anti-stress reflexes and maybe on sleep reflexes. And then once we get that really under control, then we can work on muscle tension. So there's always a way, there's always an approach. If someone does have a problem that the body doesn't have the resources to self-correct, that does not mean that reflexology is a waste. It always increases circulation. It always increases relaxation. It shifts the body from sympathetic or fight or flight into parasympathetic or rest and repair and rest and digest system. And it balances everything else that it can. So even if there was something that the body could not correct, a particular thing, you could still have really promising effects in wellness overall for your client and your client's health. And it works preventatively as well. So I hope that helped. I hope that helped with expectations. I hope that helps with feeling open to work with people, your friends and family group. There's one contraindication, which means don't do reflexology. It's blood clots. That's not something that reflexologists will work on their clients if they have a blood clot. Otherwise, just as long as the feet are healthy and there's nothing contagious on the foot like athlete's foot, then you can just go right ahead and work on yourself or work on others. It's very, very safe. Make sure your client stays in relaxation while you're working on them and can help talk to you and guide you through where the reflexes are tender, where there's sore spots on the feet, and where there are. Cooperatively work with them, make sure they stay relaxed, but work on them. Work on the spots that you find that are tender, okay? And that's probably the biggest way that you could just start playing with reflexology very safely and start to see what the effects are on your own. If anybody is interested in actual training for professional training, even if you are already a professional body worker in some other modality like physiotherapy, massage therapy, it's very helpful to add some of these reflexology approaches into your treatment. If you do energy work like Reiki or therapeutic touch, we can also do energetic-based reflexology, and again, a selection of certain reflexes that would augment the treatments that you're doing. If you have never done reflexology, I hope you did today join us and do some reflexology. And you're also welcome to join into our Foundation Reflexology course because we can teach you from scratch to have a really rewarding career. Our next live stream, which is coming up on Wednesday, is focused on living your purpose in the healing arts. So we'll talk about how to enjoy a career in the healing arts and what your options might be there so you can follow your passion. Okay, thanks everybody for joining us. We are reflexologyasr.com. Contact us if you have any questions. And actually, Crystal, did anyone ask any questions during the presentation? Yep.
I do have two questions. Do you do the same routine on both feet, or do you just work on one foot?
If you're doing, okay, so Crystal had just read off a question that came in from one of you guys. So do you do the same routine on both feet or just one foot? What you'll notice today is that I shifted feet, but I did the foot that related to the side of the body where there was a problem for the hip, and I did the other foot that related to the side of the body where there was a shoulder and pectoral problem. So when I do the full routine though, or when you do the full routine, reflexology should be done accessing the whole entire body and all of its parts and systems, which means the assumption here is that I went through a full reflexology session. I would have worked both feet and touched on all the reflexes relating to every body part, every organ, every gland. And then I would have broken away from the routine and I would have treated specific target reflexes for a specific client goal. Okay, so in general, yes, you're working both feet. They're not identical because you've got, for instance, a liver on the right side and spleen on the left, right? So the reflex charts are different right to left as they reflect to the body. But yes, whole body reflexology treatment, then break off and do more work on target reflexes.
Okay, and I do have a question here. What about working on someone with prostate cancer?
Okay, so that's a really good question. So yes, there are reflexes for the prostate. I'm going to answer this as if it's a question about cancer in general, because it's going to be the same answer and the same approach. Yes, you can, as a reflexologist or as a support person with someone who has cancer, work the reflexes to help someone who has cancer. So either, let's say you can do post-operative work or pre-operative work, prepping them for surgery, getting everything to work as well as it can, boosting the immune system. Maybe they have surgery and you can do post-surgery reflexology where you're helping the body heal any incisions and again boosting the immune system. If there is not surgery planned or has happened and people might be doing chemotherapy, radiation or medication, then yes, you can safely do reflexology. And reflexology can alleviate a lot of symptoms that not only are from the cancer itself, but also potentially from some of the treatments of cancer. Reflexology has an excellent track record in pain relief. So that's a really big part of it. and it increases circulation, and it can also help boost the immune system. Now, when it comes down to working with particular cancers, then you would work the immune system, the central nervous systems of brain and spinal cord, and the endocrine system, which is all the hormones. And then you go and focus on the particular area of where the cancer exists. So whether it's lung cancer, prostate cancer, go to the organ and specifically try and find the tender spot within that organ reflex, because that's where it's really going to need you to work more. And then you can work the flushing systems like lymph, kidney, digestive. So really kind of focusing on the body's defenses and then the body's flushing systems. Okay. And now reflexology doesn't mean you're going to cure cancer, right? You're only accessing, talking to the body about its own inner resources, which does mean sometimes amazing things happen and cancer is clear when medical establishment wasn't necessarily expecting that. So I am personally aware of several times when that's happened, when people go back in for a follow-up and they're like, where's the tumor? And they've been doing reflexology or perhaps other kinds of holistic health. But I have also been supportive in a professional role of people who are going to transition through death, right? They're going to go into death based on an incurable disease or cancer or something like that. And in that case, we can help with sleeping, with pain management, with anxiety relief, and we can really kind of keep that nurturing touch happening, which is healing right through the end, no matter where they are in their path.
Okay, and we got one last question. When would you not work on the foot? Example, foot injuries or some type of skin condition.
Okay, so the next question is really about contraindications or special considerations. That means, when is it not safe to do reflexology? The only real internal condition that is like a true and genuine contraindication for reflexology is blood clots. That's called thrombosis. And the idea here is you don't want a blood clot to go to the brain for stroke, heart for heart attack, lungs for pulmonary embolism, right? So if you're increasing relaxation to parasympathetic mode, blood vessels dilate. When you're relaxed, you're increasing circulation and a blood clot theoretically could travel. Any other kind of special consideration is, I guess medications. If people are taking medications and now their body starts to work better, then maybe they're going to be over-medicating, so they should track that with their prescribing physician. But other than that, things you wouldn't want to touch on would be conditions of the feet. Either you don't want to introduce germs into the body, so cause no harm, or you don't want to potentially cross-contaminate from one client to another client or even to you into your own hands. So the things that you wouldn't work on for possibly causing a danger to your client is anything that's open, any open skin cracks or wounds, anything that's unhealed, because you don't want to introduce anything to your client that could be dangerous. Anything that could be transferred to you, really common ones are things like athlete's foot, where it might be like spongy, whitish skin, maybe flaking or peeling, may look a little bit raw, any cracks in the skin, toenail fungus, those are also contagious. Warts won't be contagious if they're completely sealed, but if they're open, they would be contagious. So there's stuff like that. So there's you can easily look up contagious foot conditions online and see what you would not want to work on. No list is going to be comprehensive. There's always stuff that crops up that can surprise us. So I'd ask our client, like, what do you know about your feet? What's this thing happening on the foot, right? Also be very aware with your diabetic clients who have diabetes, is they may have sores that don't heal, and they also may have the beginnings of or some degree of necrosing tissue. Okay, so shoot, I just forgot the name of that, but does anyone know that in this room? I've just forgotten that, right in the blue. When diabetes have like that, a little black spot of skin. I can't believe after like 25 years, I forgot that word. Anyway, so sorry, I just left my head. But for diabetics, if they have like a dark red or brown spot or a blackish spot, that means danger. That's immediate danger. And they need to go see an emergency right away, because that actually is dying tissue that wasn't able to heal for people with diabetes because they've got restricted circulation and nerve function, particularly in the lower extremities. So that's one thing to watch out for. If you're working with someone who has diabetes, watch out for any markings on the feet that don't look like skin has integrity. Necrosis is dying tissue, yeah, but there's a particular word for it with diabetes, and I've just forgotten it. Anyway, so be it. So that's a good question. So yeah, any conditions of the feet that could be contagious, look those up. Okay, super. All right, thanks for spending time with us, everybody. I really appreciate that you're watching and hanging out with us, and we welcome comments after the fact. So get a hold of us if you have any questions or if you want to pursue some training. Bye.